is Caroline West, and this is my medicine administration video. Lacey Talbin is my videographer, and McKenna Skitch is my evaluator, and will also be my second RN for double checking my high-risk medications. Right now, I am in the medication closet at my facility, and the first thing that I'm going to do is gather all of my supplies and check all my patients' information. So right now I have Ms. Wheeler, and I'm first checking the provider orders. She has been ordered 250 milligrams by mouth of digoxin, a B12 shot to be given intramuscularly for 1,000 micrograms or 1 milliliter, and an insulin injection of Levemir, 10 units subcutaneously once a day by Dr. James Folk. I'm reviewing my patient's record, and Ms. Wheeler has a codeine allergy. And according to Ms. Wheeler's information, there is nothing. Her lab work from this morning revealed a hemoglobin of 10 grams per deciliter and her hematocrit of 30%, which is low. Her digoxin levels are low. Her blood glucose is 132 milligrams per deciliter, and her heart rate is at 79. In reviewing these labs and reviewing my medications, there is nothing that would contraindicate the administration of any of these medications. So now I'm going to go ahead and get my supplies. First, I'm going to get my 250 micrograms of dioxygen. I'm not going to be able to say that the whole video. Digoxin. Here we go. And now I'm checking the order. So I have digoxin 250 micrograms, PO once daily, holding for heart rate less than 60. The last heart rate was at 79, so we're fine there. And now I'm checking the medication administration record. Digoxin 250 micrograms by mouth once daily. So I will gather that. I will get a cup and a medicine cup. Next, I have Mrs. Wheeler's vitamin B12, 1,000 micrograms to be administered intramuscularly. So I'm going to pull my vitamin B12. It is in a 1,000 microgram, so I will use this entire vial. For this medication, I will be giving, because it is a 1 milliliter, I will be administering this in the deltoid, and I will be using. Before I do this, I can use a 3 milliliter syringe and just fill it accordingly. And I'm going to be using a 25 gauge 5/8 needle. So now I'm just going to verify once more, vitamin B12, 1,000 micrograms intramuscularly. And now with the NAR once again, vitamin B12, 1,000 micrograms intramuscularly. And then lastly, I have the patient's insulin, her Levemir, 10 units to be delivered subcutaneously. So first I'm going to retrieve an insulin syringe. Okay. Whoops, wrong drawer. Okay. And here it is. So here is my Levemir, 100 units per ml, and I'm going to be giving her my 10 units subcutaneously. Okay, and then I'm checking my MER, Levemir, 10 units subcutaneously. Okay, great. So I have gathered all my supplies. I just need some gauze.
Yeah, because you can do.
And now I'm going to leave the medication closet and go into the outside of the hallway. Oh, and also before I do anything, I'm going to check the expiration date on all of my medications. And luckily, these all expire in 2030, so we've got time. So now I'm going to leave the room and I'm going to be outside of my patient's room and I'm going to do the 5 rights check once again to verify that I have the correct patient, the correct dose, the correct medication, the correct route, and that I'm administering at the correct time. So once again, we have Miss Jamie Wheeler. We have we have Levemir, 10 units subcutaneously once daily, to be given at 8 a.m. It is 8 a.m. We have vitamin B12, 1,000 micrograms to be given intramuscularly once a day. And then we have the digoxin, 250 micrograms to be given by mouth once daily at 8 a.m. So now we're ready to enter the patient's room. Good morning, Mr. Wheeler. I am Caroline. I am going to be your student nurse today. We're going to be giving you some of your medications. Before we get started, I'm just going to go ahead and check your armband here. Would you please provide your full name and your date of birth? Okay, thank you very much. And I see you have an allergy band here. Would you please verify what your allergy is? The patient would say codeine, and I would double check that, and that is correct because he does have an allergy to codeine. Okay, so now I have formed hand hygiene. I'm going to don my gloves, and I'm going to further explain to my patient. So, Mr. Wheeler, I am here this morning to give you 3 medications. I'm here to give you your digoxin by mouth. This is an antiarrhythmic, so that's going to just help with your history of heart failure and make sure that we are on track there. Okay, and then I'm going to give you a shot of B12. You're showing symptoms of a vitamin B12 deficiency, so that will help you find some relief. And then lastly, I'm going to give you your daily insulin injection for blood glucose. And now, as I've explained everything to my patient briefly, I'm just going to perform my pre-assessment on my patient. First, for the digoxin, I'm going to go ahead and monitor the patient's apical pulse for 1 full minute before I administer it. If his pulse rate is below 60, then I will notify the provider, but as of right now, his heart rate is showing 79. And and then for vitamin B12, I'm going to, again, in the patient's history, we did see that he was fatigued and that his pallor, and that is showing signs right now. And then for the Levemir, I'm just going to go ahead and I'll make sure that I check my medication twice and just continue to monitor his blood glucose and assess for any symptoms of hypoglycemia before I administer the medication. Okay, before we get started, I'm just going to make sure that you have all the privacy that you need. And we're going to go ahead and just bring you up a little because I am a little on the taller side. Alright, well, we're just going to make sure that the head of the bed is at a 45-degree angle for the patient. I'm just going to put this down. Okay, here we go. Okay. First, I'm going to go ahead and give the patient his oral medication this morning. And at this time, I'm going to begin by doing my 3rd check of this medication. Mr. Wheeler, I have your digoxin this morning. It is 250 milligrams by mouth to be taken once daily. I'm going to go ahead and verify that once more to verify that I have the right patient, the right dose, the right route of administration at the right time, which I do, as it's 8 a.m., Mr. Wheeler, 250 micrograms PO once a day. Okay, so now, Mr. Wheeler, before we take this, I just want to tell you a little bit about why you've been given this. This is going to just help with your heart. You do have a history of congestive heart failure, and we want to keep you nice and safe here. Your hematocrit was a little low, and your dioxin levels were a little bit low when we took your labs. You should experience an increase in your cardiac output, and this will relieve any of the severity of heart failure. Any side effects which we will monitor for you for would be anorexia, nausea, vomiting, fatigue, and bradycardia. Okay, are you ready to take your medication? Great. So I will go ahead and put it in the medication cup. I will first assess my patient's ability to swallow. Great. I will give my patient his medication, provide drink of water, and then ask the patient to say "ah" to verify that he has taken his medication, which he has. So that is done. Okay. Mr. Wheeler, next we're going to go ahead by giving you your insulin. I'm sure you're familiar. As a type 2 diabetic, you have to take your insulin every day. This is your Levemir. Okay, and I'm going to do my third check to ensure that this is the right patient, the right medication, the right route, the right dose, and it's at the right time. It's to be given once daily, 10 units subcutaneously. Levemir 100 units per ml, 10 units. And then I'm going to verify that again with the MAR. Levemir 10 units subcutaneously once daily, and everything matches up there. Okay, now I'm going to just go ahead and prepare the medication. First, I am going to clean the vial. Okay. Okay. And we are giving 10 units, so I will uncap my needle. Now first I'm going to pull back onto the 10 units and inject this into the vial. Okay. Okay, and then I'm going to, first I will inject that air back into my vial, and now I'm going to pull 10 units of Levemir. Okay. Now Levemir is a high-risk drug, so I'm going to ask McKenna to verify. McKenna, what do I have here?
10 units of Levemir.
Thank you very much. Okay, now, Mr. Wheeler, we are going to go ahead and give you your insulin shot. Your blood glucose, the last time we took it, was at 132 milligrams per deciliter. You need your insulin to lower your blood glucose. I have verified that this is the correct medication, and I am going to expect that we're going to be able to control your blood glucose levels, and you may experience a little hypoglycemia or low blood sugar, but we're going to continue to monitor, and you will feel that your sugars are in check after we administer this medication. Okay, we may see a little bit of nausea or headache, but we're going to go ahead and make sure that we keep an eye on you, and then we will get you all regulated later. I'm going to give this shot in my patient's abdomen, as it is a subcutaneous medication, and I'm first going to ask Mr. Wheeler where the last time he had his insulin, where they gave it, and he's going to tell me here. So I'm going to go ahead and give it on this side of the abdomen, about 2 inches away from the umbilicus. I'm going to start by cleaning in a circular motion. We are going to pinch the skin of the abdomen. I'm going to inject in a darting motion. And then I'm going to insert slowly for 10 seconds. 8, 9, 10. And then I'm going to hold for 10 seconds. And I'm going to withdraw the needle, withdraw that, and dispose of this immediately in the sharps container. Okay, then we're going to just, for my patient's comfort, put a little gauze on there. All right, very good. Thank you very much, Mr. Wheeler. Okay, next I have my patient's vitamin B12. My patient has reported that he was admitted for shortness of breath and extreme lethargy. And in his labs and on assessment, we have found him to be pale and very lethargic. We are going to go ahead and administer him a shot of B12 to help with that B12 deficiency. I'm going to go ahead and draw that up and do my third check. Okay, I have my vitamin B12, 1,000 micrograms to be administered intramuscularly today. And my MAR states I have vitamin B12, 1,000 micrograms to be administered today. And this is for James Wheeler. So again, I have verified my 5 rights of administration, my right route, my right patient, with the right medication, the right dose at the right time. Okay, so I'm going to go ahead and get that ready for Mr. Wheeler. I am also, I'm going to administer this into the deltoid of the patient, as it is a very 1 milliliter of dose, and I'm going to be using a 5/8 length and a 25 gauge. Now this is a single-use vial, so I am not going to inject air into this before I give this to my patient. Okay. Just see here. Actually, I lied. It's a multi-dose vial. I don't know why I said that, so I am going to go ahead and inject air first. So first, I'm going to pull back that one. Sorry, I'm going to actually start that over again. I'm going to get a new needle and do that one more time. Okay. Okay, let's try that one more time, shall we? Okay, so the provider's order calls for 1,000 micrograms, and there is 1,000 micrograms per ml in this, so I'm going to administer 1 milliliter. And this is a multi-use vial, so I'm going to first inject 1 milliliter of air into the vial. Okay, and now we're doing it. Okay, I have my vial, my syringe full of 1 milliliter. Okay, now I'm going to recap using my scoop method. Okay, now before I put on the appropriate needle, I'm just going to explain to Mr. Wheeler. Mr. Wheeler, now last but not least, I have your B12 injection. I'm going to go ahead and give this to you in your deltoid today. This is going to relieve those symptoms of fatigue and the pallor that you've been experiencing as a result of this B12 deficiency that we're seeing. There'll be a little bit of pain at the injection site, but that's really it, and we'll just make sure that we continue to monitor you so that you're feeling better. I'm going to go ahead and clean my patient's skin and identify the appropriate landmarks. So I have found my patient's acromion process. Then I'm going to go 2 fingers down and then make a V. And in the middle of my 2 fingers is where I will be administering the shot. And now in this spot, I'm going to clean around it. Okay. Okay, now I'm going to go ahead and switch my needle, twisting off the cap, opening this. Okay, Mr. Wheeler, here we go. I'm going to Z-track laterally 1 to 1/2 of an inch and inject 90 degrees in a darting-like motion. Just a quick stick, Mr. Wheeler. And then I'm going to slowly inject for 10 seconds. And now I'm going to hold for 10 seconds. Going to release the wheel, release my hands. I'm going to engage my safety, and then I'm going to dispose of my needle and clean up. Okay, Mr. Wheeler, how are you feeling? Great, thank you very much. I'm hoping that everything is good today. We're going to go ahead and just ensure your safety and your comfort this morning. I'm going to get your bed to the proper height, and I am going to take off my gloves. I'm going to doff off. And then I'm going to document the time, the date, the dose, the medication, and the route of administration. And then I will expect that I will see a decrease in the severity of the patient's heart failure, increasing his cardiac output as a result of the digoxin. I will see a resolution of the symptoms of his B12 deficiency as a result of the B12 shot. And then lastly, we will see control of his blood glucose levels. And we will continue to monitor for any hypoglycemia, any pain or swelling at the injection sites, and any anorexia, nausea, vomiting, bradycardia, and fatigue as a result of the digoxin. And that is my video. Thank you.